Home stretch, right? I know it's hard. I know it is hard to pay attention for this long. It's a long day. So we are going to move into our next topic, and we'll talk maybe an hour or so. And then I'm thinking we'll do another question and answer period. So this to me, oh, look, I spilled water. Anyway, this to me is probably the hardest topic to talk about. I mean, there was a lot of content before, but emotionally, we're going to talk about your first 100 days as parents. Like, what does that mean? So, let's talk about what it looks like, right? All the hard stuff is over, seemingly, right? Seemingly, the hard stuff is over. You've had your baby, you have, you know, let's say you've had your baby, you've gone through labor, you've been through the pain, you're starting to recover, and now you've brought your baby home. And what is it? What does that mean for you as a couple? What does that mean for you as a family? And we're having babies in a crazy time. We're hopefully towards the tail end of a pandemic. But before we start talking about all that, so the World Health Organization, which is a pretty prominent healthcare organization that kind of dictates protocols, procedures throughout the world, recommends breastfeeding for the first 6 months after delivery. Now, everybody makes their own choices in regards to how to feed your baby. And if I'm being really honest, right, like I think that the absolute happiest baby is a fed baby. So I think that if you make a decision not to breastfeed, that is 100% your choice. So obviously, it may not be possible for everyone, whether it be medical reasons or personal choice. So we're going to talk about breastfeeding and formula feeding in this section, right? In the first 100 days as parents. So when we talk about um, the nature of breastfeeding, I want you to have a fairly decent understanding of the physiology of breastfeeding, how it works. And it'll take, just about, I'm guessing, an hour to maybe an hour and 5 minutes to kind of explain. Formula feeding takes a little less time to explain. And so for that reason, whatever you decide to do, just know we're going to cover both, right? Formula feeding is just a little bit more straightforward. So let's talk about breastfeeding for baby. What are the benefits of breastfeeding for baby? So there's better mouth and teeth formation with breastfeeding. There is definitely a lower incidence of having allergies, having skin conditions like eczema. We know that mom passes really solid antibodies to baby via breast milk. So we know that babies who are breastfed have a slightly stronger immune system. So that's important to know. And we know that most of the time, breastfeeding or breast milk, rather, is really well tolerated. So babies tend to have less stomach upset. They tend to digest breast milk a little bit more readily, and they tend to suffer less with gas and with constipation. And believe it or not, it has been studied whether breastfeeding babies have a slightly higher IQ than babies who are formula fed, and that has actually been proven. So, brain development is accelerated in babies who breastfeed. So, we know that as they grow, their IQ is slightly higher. Now, look, I came from an entire generation of kids that were bottle fed. So I don't know. I think I'm pretty smart. So does that mean if you choose to formula feed that you're doing a disservice to your baby? No, it doesn't mean that at all. I'm just telling you, what we know, what the stated facts are, and then, help you to make a decision. But when you see all of those benefits to breastfeeding and you're on the fence, don't just sit back and go like, wow, maybe it's worth like just giving it a shot. So some people feel like, nope, no way. I'm not breastfeeding. I don't like the idea of it. It just seems gross to me. I've heard all of those things. But when I sit down and I kind of talk to parents about truly what the benefits are of breastfeeding, then yeah, sometimes, you sit back and you say, well, maybe I'll do it for a month. Maybe I'll do it for 6 weeks. Any length of time that you choose to breastfeed is better for your baby. And so I would tell you, just maybe throw the idea around. Even if you've never thought about it before, maybe just throw the idea around. Maybe I'll do it for a couple of weeks. If you can get some antibody transfer to your baby in the first couple of weeks of breastfeeding, then you've done something even better for your baby than if you were going to use formula. We know that we cannot take what is in the breast and duplicate it in a formula type of a form, right? So yes, you can put breast milk in a bottle and feed it to your baby, but we can't duplicate what we find in the breast and put it in formula. So I think there's definitely some benefits. So let's talk about even more important, I think. I mean, there's definitely benefits for the baby, but let's talk about the benefits for the breastfeeding mother, right? There is really good evidence for the breastfeeding woman that there's a reduced chance or a it's less likely that mom will develop breast cancer and ovarian cancer if you've breastfed a baby for 6 months or more, right? Significant. There's a fourfold decrease in the risk of breast cancer and ovarian cancer. That's significant. You will lose your baby weight faster if you choose to breastfeed. So some of us who have a little bit of vanity when we have gained a little bit of weight in pregnancy, it is nice to know that if you choose to breastfeed, you will get your figure back a little bit sooner. If I had known how much weight I would have lost when I was breastfeeding, I probably wouldn't have been a midwife. I probably would have been a wet nurse and breastfed everybody else's babies. So you do lose weight very quickly when you're breastfeeding. It doesn't come off as quickly as when you're when you're bottle feeding. So that's another really nice benefit to breastfeeding. It is free. That you don't have to pay for nipples. You don't have to pay for formula. You don't have to pay for bottles. So it is a really inexpensive way to feed your baby. And in addition to all of that, it's a really nice way to bond with your baby. I would tell you that, bottle feeding does provide the same type of bonding experience, but you really can't beat the cost savings when you're breastfeeding. So, if finances are an issue, breastfeeding is the way to go for sure. All right. So when we talk about what you can eat, like what do you want to think about when you're nursing? You can pretty much eat whatever you want. There's definitely an increased caloric requirement. So it's almost like you can eat more and the weight still like falls off your body. So you can eat and drink what you like when you're breastfeeding. There's really no restrictions. You don't have to worry about like, do I need to cut back on calories because I want to lose my baby weight? You can eat whatever the heck you want and the weight will still come off. When we talk about caffeine, are there caffeine requirements? So there's definitely some, caffeine limitations in pregnancy. We talk about 8 to 12 ounces, no more than 8 to 12 ounces of any caffeinated beverage during pregnancy. The rule pretty much remains the same for breastfeeding. So, more than 1 to 2 cups of caffeinated anything, whatever that is, coffee, tea, soda. So, no more than 1 to 2 cups a day while you're nursing. Marcia Dimes makes a recommendation every, I don't know, probably every several years. And it does change. So, it used to be many years ago, no more than 3 to 5 cups of coffee or tea in a day. And they reduced that to probably 10 years ago, to no more than 1 to 2 cups a day during pregnancy or breastfeeding. So when we talk about caloric requirements, it's actually increased above and beyond what is recommended in pregnancy. So in pregnancy, the caloric increase is about 300 calories a day to maintain a pregnancy. That's pretty easy. That's like it's like a container of yogurt when you think about it, right? But when we talk about breastfeeding, it's about 500 calories a day. So just know that when we're, thinking about what those 500 calories are, obviously it would be a little bit nicer to make them healthy calories. But if you want to go ahead and have an extra piece of cheesecake because you're breastfeeding, you can go ahead and do that. The weight is still going to come off. So you want to have enough calories in your diet to actually have enough milk to make it, your body can make enough milk for your baby. It is definitely work for your body to actually produce breast milk. So we want to make sure that our caloric requirements are met so that we can actually produce enough breast milk for our baby. So there is a really, really cool cookbook called the first 1,000 days, meaning the first 1,000 days, and it's included in our resource page. So really great cookbook that you can use not only for pregnancy, but for lactation as well. It's got some great healthy recipes that you can check out to be able to meet those caloric requirements, but meet them with the right food. So I always joke, like, yeah, go ahead, you can have an extra piece of cheesecake, but really, ideally, we want to nourish ourselves with, the right calories in order to be able to be as healthy as possible so that we are producing the right amount of milk for our babies and the right quantities of milk. And not only that, but the quality of our milk changes with what we're eating as well. So what happens? What's the physiology, like the pathophys? What is it? So definitely your breasts will change in size. You may have noticed that already. Sometimes your bra size can go up, 2, 3, 4 cup sizes by the time your pregnancy starts till the time you start lactation. So there's definitely, hypertrophy of the breast tissue, meaning that you will have really significant growth in the size of your breast to accommodate the milk ducts, which are now starting to fill up. The color of your breast may change, but more importantly, not necessarily the tissue in your breast, but the round area around the nipple, which is called the areola or the areola. I've heard it both ways, but that is going to change color. It gets much deeper, much darker. The nipples can actually enlarge. So you can look at your nipples and say, oh my gosh, like my nipples have never been this large before. But that is a very common sort of bodily change that happens when we're talking about breastfeeding and what happens to the breast. Your breast may actually start leaking in pregnancy. So if you notice that inside your bra, you see like a crusty little discharge on the inside part of your bra, normal. That is something called colostrum. That is the very first or early beginnings of breast milk. So when you're pregnant, you may start to see a little bit of that leakage. Some women never see it. So some women don't have any leakage at all, and they may not see anything until they actually have a baby to put on the breast. Then they may start to see a little bit of colostrum. Both of those situations are normal. And if you don't leak, it doesn't mean that you're going to have trouble breastfeeding. I've heard that too. If I don't see any leaking, any colostrum, does that mean that I'm not going to make enough milk? Absolutely not. Not at all. So whether you leak milk during pregnancy or not, that does not indicate whether you're going to be a good breastfeeder or a poor breastfeeder, right? It doesn't mean that you're not going to make enough. You will likely make more than enough milk for your baby. All right, so let's look at the hormones that are involved with breastfeeding. So oxytocin, which we talked about, right, which is your body's hormone that is released during labor, that is specifically responsible for the actual milk flow, like how it flows through the breast. And then prolactin, which is another hormone that's made during lactation, is actually responsible for the quantity, the actual milk supply. So take a look at this this slide on the right side. I want to pull up my pointer, and this is a typical human breast. Okay, and when we look in the back of the breast, we have our muscle layer right here. We have the fatty layer, and deep within the fat, here's your ribs, right? Your rib cage right here. And then deep embedded within the fat, you'll start to see like your milk ducts, right? Right here. And then you have these glands that are what are going to produce your milk, right? Your ducts are right here, and it delivers it to the nipple, which has, multi or many different microscopic openings. You won't see them. You'll just see like milk drip through the breast. You won't actually see the openings in the breast, but you'll see there's multiple openings and ways that the milk actually gets to the breast, to the baby. And then here we talked about the darkening of that tissue, the areola right around the breast, right, which surrounds the nipple. So there's definitely a darkening of that skin, and that's 100% normal. So breast milk looks like this. In the first couple of days, you're going to have what's called colostrum, very, very high in terms of nutrient content, but very low in quantity. So it's almost like me giving you a prenatal vitamin. Here you go. This has everything you need, all your vitamins, all your nutrients, but you could swallow a prenatal vitamin and say, I'm kind of hungry. Can we head out to get something to eat? So nutritionally, it supplies the baby with everything that the baby needs, but it's not a lot in terms of filling the baby's stomach. So colostrum happens on somewhere between day 1 and 3. And that's the very first beginnings of breast milk. And then day 4 to 14, you're going to have what's called transitional milk. So that's the milk that develops between the very early colostrum and then what's called mature milk, which happens about 2 weeks and beyond. So there's different stages of milk production. They are all significant. They are all important for your baby. So look at the composition changes. I want you to see these 3 different vials of breast milk. So colostrum, right? Looks like this. It's kind of a little bit yellowish. Transitional milk is a little bit clearer, right? It can be whitish, looks like milk, but a little bit clearer. And then mature milk actually looks like thick white milk. And really, even during a feeding, the quantity and the consistency of your milk can change just from one feeding to the next. But exactly what you see here is colostrum. You'll see transitional milk in the middle, and then you'll see that sort of mature milk that happens after the second week. So your baby has sort of hunger cues, and you're going to get really good at starting to notice what those hunger cues are. So it's important to kind of really pay attention to what your baby's doing to know, like, is it hunger, or is my baby bored, or is my baby sleepy? All these things that babies do that tells us what we need to do to care for them. So when the early warning signs that baby might be getting hungry, and this can happen really as soon as baby starts to, come on your chest, right after, in that first golden hour that we talked about before, you can see your baby start to stir a little bit. They start to pick their head up. They start to move their head like towards the direction. If you're holding a baby on your chest, right? If I have my little baby here, I'm holding her on my chest right after delivery, right? I'm just holding on to her. I may start to feel her start to move a little bit. And sometimes babies will actually move in the direction of the nipple. It's amazing to watch that happen. It's like instinctive. When you see like animals that are first born, how do they know that they get up and they attach right to the nipple of their mother? Babies, if you leave them alone on the chest, will do the exact same thing. They will start to stir around and make their way towards the nipple. You'll start to see their mouth open. So usually it leads with the chin, right? You start to see their mouth open a little bit and move in the direction of mom's nipple, right? It's very subtle, but if you look for it, you're going to see it. And then if you see that baby really starting to turn their head significantly, right? And they're looking. So what are they doing? That's called rooting. So they're really looking for mom's nipple. So a lot of times that's what you'll see. You'll see babies do something like this, and you'll see them open their mouth at the same time. So what they're doing is they're rooting. They're looking for a nipple. They're looking to feed. The other cues that when babies really start to get a little bit more hungry, if we miss those initial signs, is you'll start to see babies stretching, like in this first sign here. Increased physical movement, right? Baby starts moving and stirring a little bit more. They're trying to tell you, I'm not comfortable, right? We don't know what that discomfort is yet. We don't know if it's a wet or dirty diaper, or is that I'm hungry. And then this is the big one, their hand. Hand goes to the mouth. Right? Happens all the time. Thumb in the mouth, very common. So all of those signs are things that you want to look for. Those are all 100% hunger cues. Now, late hunger cues. You've missed all of the prior ones, right? What are we looking for? Baby starts crying, right? Significant crying. Baby is very agitated now. That crying might actually start to increase, and you see that their face starts to turn red, right? Those are late hunger cues. So all of those things that are things that we look for to make sure that we're tuning into what our baby's trying to tell us, right? Those are all very early, mid, and late signs that our baby is hungry. All right. So when we talk about like late cues, once you get to that point, sometimes actually getting them to the breast if you're breastfeeding, can be challenging because they're already so riled up. It's like, think about you when you get really angry. Doesn't it take you like a little bit of time to calm down? Like sometimes I can get so angry that I think I don't even want to, I don't want to talk to you right now, whoever I'm mad at, right? My kids, my husband, whatever. I don't want to talk to you. I need to calm down a little bit. And then when you calm down, you're able to focus a little bit more on the task at hand, whatever you need to do. Babies are exactly the same way. So when we talk about calm crying, right? Calm crying, babies are certainly a little agitated, but they're very calm, right? If your baby is not crying a little bit, still calm, you can put them skin to skin. You can talk to them a little bit. You can actually like talk them down. They're not getting so upset. You can stroke them and that will help them to calm down, right? So and then before you put them on the breast or before you bottle feed them, right? Just take a little bit of time, calm them down so that the feeding is actually a productive feeding. They're not so agitated that they can't latch on or you can't get the bottle in their mouth. So we want to calm them down before we start to feed. So what are our positions? What are good positions for baby to feed? So there is this, right? Specific cradle hold, very easy, whether I'm using a bottle, right? If I were going to bottle feed a baby, right? That's very easy to cradle hold them. If you're going to nurse, that is more like belly to belly, that cradle hold, that is completely appropriate. There is also like a laid back type of a feeding where you simply lay back, in your bed, on the couch, whatever, and you simply let the baby lay right on top where the breast is and let the baby attach to the breast that way. I never found that worked very well when the babies were quite young. That position actually works really well when babies are several months of age. So, 3, 4, 5, 6 months. I think that laid back position for feeding works a little bit better than a newborn. So with a newborn, the cradle hold, I think, works really well. And then there is something called a cross cradle hold. And the cross cradle hold is essentially, bringing the baby to the side, right? And holding them opposite. And then there's also, which I just want to make sure they're showing, this is twins, but there's also something called a football hold. So there's cross cradle hold like this, right? Cradle hold like this. And then there's a football hold too, right? So if you were to hold the baby like a football, like you're running down the field, right? It's very easy to latch your baby on this way. This is a position that's actually used for nursing, okay? Not for bottle feeding. But yeah, you would just hold the baby like a football. You would position your breast and get the baby on the breast that way. Some women find this actually quite comfortable. Most women find that cradle hold or that sort of cross cradle hold feels a little bit more comfortable for them. So let's talk about twins. What do you do with twins? And it really depends on how comfortable mom is tandem feeding, because you could do that. It does require in the beginnings an extra person to kind of help you get both babies latched on. But a lot of times what moms do is they'll do a football hold on one side and then a football hold on the other side. And they actually hold both babies at the same time. And they let them what we call tandem feed, which is, both babies feeding one on one breast, one on the other. And that's one feeding. There's no switching and nursing on both sides with those babies. One gets one breast, one gets the other breast. When you're nursing a singleton, generally you will nurse on one side for a specific amount of time, 10 minutes, 15 minutes, 20 minutes. And then you'll burp the baby in between, right? And then you'll put the baby on the other side. So those are, specific positions. Now with twins, they're still getting burped, but one is on one breast, one is on the other breast, and then the burping takes place. Now, some women are not comfortable with that. They don't feel really comfortable nursing two babies at the same time. So what you might do is simply nurse one baby on one side, right? Burp that baby, and then put that baby down, pick up baby number 2, nurse the baby on the other side, right? Burp baby number two, and then that baby goes down. So it's really a matter of how comfortable you are. So also the other option, which I think works better when the baby's a little bit older, again, 4, 5, 6 months, is side lying. You're just laying in bed and you go ahead and you latch the baby on as you're laying down on your side. Newborns have a very hard time oftentimes with side-lying feeding, but it works really well for babies that are a little bit older, several months, 5, 6, 7 months plus. Okay, and here is that football hold that we talked about, right? That is essentially holding your baby like it's a football. Oh, love that slide. Okay, so let's talk about attachment. I'm gonna put my glasses on and let's look at these slides. So there's an acronym we're gonna talk about in just a second. But when we talk about how we're latching that baby on, because that really is the key to successful breastfeeding. Now, let me tell you that anyone who tells you that if it hurts when you're breastfeeding, you're doing it wrong, I think has forgotten what it feels like to breastfeed. In the first couple of weeks when you're breastfeeding, latching a baby on can be like toe curling. It's uncomfortable. And the reason for that is this is no longer a playground, right? This is not a playground. This has function now. So babies, when they latch on, they are hungry. So they latch on like with a vengeance. They want to eat. So they are trying to suck really hard, and that can be painful. So when we're talking about how we latch a baby on, how do we get them on? We want to lead with the chin, right? Look at this dark part. This is the areola right here, the areola, whichever you want to call it. One thumb goes on top and the fingers go underneath the breast, right? We want to get as much of this dark part of the breast up and into the baby's mouth so that the nipple actually ends up, where this is in stages, right? So if we're looking in stages, as much of the dark part of that breast is going to be aimed towards the baby's mouth so that that nipple is aiming towards the roof of the mouth. Here you go, bottom slide. See that nipple up towards the roof of the mouth? The baby gets as much of that dark part of the breast in the mouth so that once it starts sucking, those milk ducts can actually start to deliver the milk towards the back of the throat. So this is a very sort of slow step by step process of what breastfeeding actually looks like. In reality, this is seconds. Like it all happens within seconds. And sometimes babies will not get on initially, especially when they haven't done this, very frequently. It is a process and it definitely takes practice. So don't get frustrated. Don't feel like I can't do this if you don't have, a good feeding, even in the hospital while you're there. The other thing I want to tell moms who are choosing to breastfeed is that in a similar way that one of our pets can feel our energy, right? Like I always tell people with dogs, like dogs can feel your energy travels right down the leash to your pet. It's the same idea with babies. If we're feeling very anxious, oh my God, I don't know if I'm doing it right. Am I doing it right? What do you think? Can somebody check this? That anxiety gets transferred right to our babies. So when it comes to anxiety, we want to try to calm down as much as possible. Say, okay, I'm going to give this my best shot. If it doesn't work, there's people here that can help me, right? There's somebody here that's going to help me get my baby on the breast so I can feed them. My baby is not going to starve. The hardest thing for moms, I think, is to think that they're going to starve their baby. And listen, partners, this is important to know. When your partner is trying to breastfeed, the last thing you want to say, even if it's well-meaning, is he or she looks hungry. If your partner is trying to breastfeed and you say something like, he or she looks hungry, we already know that. Trust me. We already know that the baby looks hungry, and we're doing our best to try to get that baby on. Really, what might be more helpful is if you could say something like, hey, like, let's see if maybe we change position or try to take the baby off and reattach. And maybe there's a position that's a little bit better. Let's just try something different. Because saying like he or she still looks hungry, I think just reaffirms for the mother that we're not doing a good job. And that might not be your intent. Your intent might not be that you're doing a poor job, but that's how we take it. So if you see that your partner is struggling with breastfeeding, you might want to say, hey, maybe let's just try a different position and let's see if that works better. And then I guarantee your partner is going to say, okay, yeah, let's try that. As opposed to, yeah, I know I'm not getting it right. Right? Remember I said we're super emotional after we give birth to a baby and we're full of insecurities. Okay, so here's our acronym. The acronym for breastfeeding is CHINS, right? So the C is you want very close, close up positioning, and you want the baby's chin leading, right? The chin is going to lead to be able to get the nipple into the mouth. You want the head to be free, right? So the head is able to move, right? Head is free, and you want the head in line with the nipple. So if this is a hold that is coming side to side like this, we want, do you see my German Shepherd? So you want to be belly to belly with the baby, right? It's very hard for a baby to feed like this. You want the baby to be coming in line with the nipple. So you want to be belly to belly with your baby. The N is baby's nose to the nipple, nose in line with the nipple, right? Belly to belly. And you want it to be sustainable for both mom and baby. So you want to make sure that mom is comfortable to be able to breastfeed. All right, so why is that good latch so important? Let's talk about that. A deep latch versus a shallow latch. If we look at this slide A and C, okay, these are shallow latches. Baby just getting the nipple in its mouth, what you're going to hear is like a smacking sound. If you hear that sound, baby is not attached. Baby is not attached very well. So what you want to do is break the suction. Put your finger in the baby's mouth, right? Break the suction and then start again. One thumb on top, hand underneath, belly to belly, nose to the nipple, lead with the chin, and try to get the baby on again. So you want to make sure, again, that we're getting as much of the dark part of the breast in the baby's mouth so that baby gets a very deep latch, and the nipple, right? The nipple is going up towards the roof of the baby's mouth so that when the baby starts that very coordinated suck and swallow, those milk ducts are releasing that milk up towards the back of the baby's throat and down towards the stomach. So here, and look, guys, I know it's really hard to kind of just look at a couple slides and say like, oh, I know how to breastfeed now. You don't. But the best way to learn how to breastfeed is actually have a baby, to breastfeed with. So don't worry if you feel like, well, that really wasn't that helpful. What am I going to do? Once you have the baby, there are going to be usually lactation consultants that are in your facility. Midwives are oftentimes very skilled breastfeeders. Sometimes family members have breastfeed. They can help you. And usually if you're delivering in a hospital, nurses are generally on the postpartum unit certified in lactation. So they can be very helpful in being able to help you, latch the baby on appropriately. So this is an overall look at what breastfeeding looks like. But again, when you have your baby, that is the absolute best time to be able to practice all of this. So I certainly don't want you to at all be concerned that you're not going to be able to do it. So always remember earlier we talked about, it's so easy for us to kind of get caught up in what potentially could go wrong, what's not going to go right. But then we're not living in the moment. So with breastfeeding, we want to keep calm and just make the attempt to breastfeed. And that will definitely, ensure that the right hormones are being released, and that can allow for, really good milk flow. If you can get the first feeding, breastfeeding or bottle feeding, if you can get that first feeding within the first hour, if possible, when your prolactin levels are, and remember we said prolactin is really responsible for the actual supply. So if we can get that first breastfeeding session that happens in the first hour, we want to do that because our prolactin levels are really high. That's going to help us to, start and maintain our milk supply. And then we want to feed the baby on demand, meaning when we see those hunger cues, we're going to go ahead and feed the baby. In the very beginning, you're going to feed your baby every 2 to 2.5 hours. You definitely, when you have a newborn, do not want to go more than 4 hours with breastfeeding. Formula feeding, you have a little bit more leeway because formula is denser. It stays in the stomach for a longer period of time. But breast milk is very readily digested by newborns, and so you have to feed a little bit more frequently. So you don't want more than 4 hours to go by when you're looking at breastfeeding. So every 2 to 2.5 hours, and usually by the time the baby hits 6 weeks of age, you can increase the duration of time in between feedings to like 3 to 3.5. With breastfeeding in the beginning, your baby may be latched on for a fairly long time, easily 15, 20 minutes on one side, 15, 20 minutes on the other side. What is that? That's 30 to 40 minutes. And then we're doing it every 2 to 2.5 hours, right? So it takes us almost an hour to nurse the baby with one feeding. And then an hour and a half later, we're doing it again. It's not 2.5 hours from the time you finish, it's 2 to 2.5 hours from the time you start. So when you're nursing in the beginning, it can be somewhat overwhelming because you feel like you're just constantly doing it, right? You feel like it's happening all the time. You almost feel pregnant again. Like there's not a lot of break in between. People who choose to bottle feed actually feel a little bit more like personal freedom because the interval of time in between, feedings is more like 3 to 3.5 hours with a bottle fed baby. But breastfeeding on demand for the first 4 weeks, at least, is what's recommended. Babies will lose weight initially, again, because we're not giving them everything in terms of quantity. We're giving them nutritionally what they need, but in quantity, they could probably use a little bit more. So they may lose weight in the beginning, and that is expected and normal. Okay. So usually by the time baby is 2 weeks old, your pediatrician will want them to return to their birth weight. So let's say you have a baby that is, I don't know, 7'6" at birth. When you go home from the hospital, if it's a 24 or 48-hour discharge, your baby, instead of 7'6", could be 7 pounds, right? Could be 6'15". That's a normal expected weight loss. But by the time that baby is 2 weeks old, your pediatrician is going to want to see them to be back up to that 7 pounds, 6 ounces birth weight. So make sure that you're watching for all those feeding cues that we talked about earlier, right? If you see a baby's hand going to its mouth, that baby is hungry. So if that's happening after a breastfeeding session, hand going to the mouth and baby's rooting, right? Mouth is the head, the head is going, trying to grab their own hands. That is a sign that baby may still be hungry. You may want to try to continue to nurse them if you see that. And you want to make sure that you get that baby afterwards, close, skin to skin. So remember with nursing, right? You don't want the baby to be nursing like this. You want to get them flush up against your skin. So their belly to your belly, nose lining up with the nipple. Important. Okay, so here's some more top tips to ensure successful breastfeeding. We want those feedings to be efficient. And babies in the beginning, when they're first born, it's not as instinctive as everybody thinks it is. So they're not actually always efficient feeders. Sometimes they're like a little pokey. They'll like suck maybe 3 or 4 times and then they fall asleep. And you have to really work to like wake them up. So you want to think about your breastfeeding as like it's a task that needs to get done. So while it's lovely to hold your baby and watch them sleep with your nipple in their mouth, if they're not sucking and they're not swallowing, they're not really feeding. So you want to put the baby to the breast. If the baby falls asleep, what do? We kind of rub their backs a little bit. Sometimes I'll give a little pat. Sometimes I'll even give like a tiny little flick of their feet so that they wake up again and then they get back down to business, right? So when we're nursing, remember, it's a task. It has to get done because we need that baby to kind of reach back up to their birth weight if they're starting to lose weight, and they need to learn how to do it. So you want your feedings to be efficient. You don't want to allow them to really fall asleep for long periods of time and just suck, and then maybe 10 or 15 minutes later suck again for a couple minutes, and then 10 or 15 minutes suck again. You will be exhausted if that's how you choose to feed. Your baby may find that, it's totally full from one side, right? So once you separate the latch, you put your finger in their mouth, separate their latch from the breast and go ahead and burp them. And we'll, talk about this a little bit more, but burping can essentially go baby right over your shoulder. I would put like a little cloth diaper there so that if baby spits up, it's not coming on my clothing, right? You want to put your ear kind of close to baby so you can hear them and give a good pat. That's one way that you can burp. Another way that you can burp your baby is to simply sit them on a surface, lean them forward, right? My thumb, second finger, kind of resting right underneath the jawline of the baby along the ears, and then use my opposite hand to burp. Now, do you hear that? Now, I'm not, hitting the baby, but I'm also not just doing this. This is not going to get up any air And that's not going to help your baby to burp, right? It's, a fairly decent pat on the back, maybe a rub or two in between, and then continuing until you hear that burp, right? Once you've offered one side, if you get a burp from the baby, you want to try to switch sides. Just offer the other side. If your baby doesn't want it, they'll sleep. They won't take it. But sometimes your baby will take both sides. I mean, oftentimes your baby will take both sides. So you want to try to always offer the second side. Here's the other thing. Your baby's tummy, right, when they're first born, is literally like the size of, not even like, it's like a black bean. Think of what a kidney bean looks like. Black bean, kidney bean, small, tip of your finger. So there's not a lot in quantity that has to get in there, right? It's little bits. So that's why we feed little bits much more frequently, because their tummy size is so tiny, right? So they may not be able to do both sides if you have a really good milk supply from the beginning. So they do make bras that are specific for nursing, and those bras essentially have a flap, right? A little clasp up top, that, or in the center, where you can unclasp and just lower the flap of fabric down, exposing the breast, or open up, right? The clasp is here, you open it up and it exposes the breast, but the bra actually stays on. So that can be really helpful, rather than an on and off of a bra every time that you want to breastfeed. I think that there's a couple of things that you should probably have in your arsenal of, little tricks if you're going to breastfeed. One is a sort of oil-based, of a cream, not a cream, it's an ointment, and it's called Lansinoh, Lansinoh. Lansinoh can be really helpful to put on the nipples after a feeding, because nipples can get dry and they can crack and they can bleed, and that can be very uncomfortable for mom. So Lansinoh is something you can buy over the counter, and it's just a little ointment that you put on the nipple every single time that you nurse at the end of a feeding, just to keep the nipple moisturized and soft. There's also something that is called APNO, APNO. What it stands for is all-purpose nipple ointment. It is really good for patients that are having difficulty breastfeeding and are having pain. So it is a combination of the lanolin type of an ointment and some pain relief, Motrin, usually Motrin, like a liquid type of a Motrin, that is put in to help the pain of latching on. It is usually called into a compounding pharmacy. And it is called in by your physician's office. So your physician's office or your midwife's office should know about APNO. It's very, very popular. And if you're having a lot of pain with breastfeeding, it is definitely something you want to ask for. Can you call in all-purpose nipple ointment for me? You can look it up online too. You can make your own all-purpose nipple ointment. The ingredients are posted online, and you could simply do it at home. So it's not something that you actually have to have compounded, but sometimes it's easier if it's compounded for you. Okay, biggest question we get with breastfeeding: how do I know my baby is getting enough milk? So your baby should be gaining weight after the first 2 weeks. So in your first 2 days after birth, your baby is likely to only have a few wet and or dirty diapers, okay? But ideally, when we're talking about how many diapers a baby should have in a 24-hour period to know your baby is getting enough, and again, this is with breastfeeding, should be 6 to 8 wet and or dirty diapers in a 24-hour period. All right. And that's how you know your baby's getting enough, because we can't quantify breast milk unless we're pumping it out and putting it in a bottle. And some of you type A people, right, you know who you are, might need to do that to alleviate your own anxiety. Pump the breast milk out and put it in a bottle and give it to the baby that way, and describe it in terms of ounces. Is that necessary? 100% no, it is not necessary. So you can very easily, do like a diaper count. And if your baby is having 6 wet and or dirty diapers in 24 hours, baby's getting enough. The other way to know the baby's getting enough is the baby is steadily starting to gain weight. You're going to see your pediatrician quite frequently, so you'll know that. So, all right, at the beginning, your baby is going to pass a meconium stool. It is a thick, tarry, black type of a stool. It's sometimes a little harder to remove when you're trying to clean the baby off. It's called meconium. It's a very thick poop. It is usually by the end of day 2, you've already seen it. By the time you're hitting day 3, baby's starting to metabolize what they're taking in, breast milk or formula, and their stool changes from that very thick, dark kind of poop to a thinner, lighter, sort of runnyish, brownish, greenish type of a stool that is much easier to clean up when you're changing a diaper. All right. So then from day 4 and on, your baby should pass at least 2 kind of yellow stools every single day. That's a sign that your baby's liver is starting to mature and they're starting to metabolize what's stored in the liver, which is a substance called bilirubin. So that is metabolized through the liver. And it's also responsible for jaundice. If the bilirubin level is very high, your baby is more likely to have jaundice. But once the baby's liver matures, 4 days, 5 days, 6 days after birth, that is all going to get metabolized. And you will see that when you open the diaper in like a yellowish, bright yellow, sometimes seedy consistency type of stool. That is quite normal. So if you're ever concerned about any of this, make sure that you call your pediatrician's office. Almost every pediatrician I know has someone certified in lactation in their office. Some of them even have lactation consultants that are available to speak to you by, Zoom or phone call. So, here's what you need to know as far as breastfeeding support, because I think with breastfeeding support is critical in being able to be successful. That is not only support from your partner, it is support from your postpartum nurses. It is support through speaking with other breastfeeding mothers, other women who have breastfed successfully, because breastfeeding can really make you feel like you don't know what you're doing, right? And it's a learning process. It's not as natural as people think it is. It's not like you have the baby, you put them to the breast, boom, they latch, and it's a good feeding. It just doesn't always work that way. There's sometimes a lot of steps to get to that point. So postpartum nurses in the hospital, excellent support. Lactation consultants in the hospital, also a great way to get some help. And sometimes those lactation consultants will do home visits. Sometimes they'll do, Zoom consults, all important. Hospital breastfeeding support groups, a great way to get to know other mothers who are experiencing the same challenges that you're experiencing with breastfeeding. There's also breastfeeding support groups in the community. So if you just Google whatever county you live in and breastfeeding as a search, or breastfeeding support group and the town that you live in, state that you live in, oftentimes you'll find that these groups meet at local churches or, local libraries or, local meeting places, and women are able to give each other support with breastfeeding. It can be really challenging. There is a really good site called Kelly Mom, right? It's a good go-to reference website for all things, postpartum, all things baby, but it's really good for breastfeeding. And then there's also voluntary support networks. La Leche League is kind of the one that's the most well-known, but there are definitely, these volunteer support networks that can help you breastfeed. So make sure that where your support lies. There's also a really good app called Breastfeeding Friend. That's going to be on our resource page, and we will get that to you after our class. Okay. So if you hit our Instagram page, which is at the Baby Academy US, we always have ongoing tips, videos, good information to kind of help support you during your postpartum journey and your breastfeeding journey. So make sure you check out our Instagram page as well. Let's talk about supplementing your baby, right? Because remember we said earlier, a happy baby is a fed baby. So, EBM stands for expressed breast milk. That would be breast milk that you actually express through the use of a pump from your own body. Donor milk, if necessary. Sometimes that's necessary if you have a preterm baby and you don't have a good milk supply yet. Sometimes donor milk is available. And then formula. These are all acceptable ways to feed your baby if it's necessary. Sometimes you don't make a tremendous amount of milk in the beginning and you gave birth to a 10-pound baby. So you might breastfeed really, really well, but your baby right after a feed, the hand goes to the mouth and they're still looking for a little bit more. That's an instance where You could pump a little bit more milk off of the breast after about 15, 20 minutes and see if you can get any more, and then bottle feed that to the baby or put it in a medicine dropper and feed that to the baby. If baby seems like they need a little bit more, or supplement with, maybe 10 cc's of formula just to kind of help settle baby's stomach. So those are options. Sometimes supplementation is medically necessary. If you have gestational diabetes and your baby's born and they have unstable blood sugars, that's an instance where baby might need some kind of supplementation because you don't quite have enough right after birth to give the baby to stabilize their blood sugar. So they might, the pediatrician might say to you, it's a really good idea if you give just a little bit of formula, or let's get a pump on you and see if we can express some breast milk and feed the baby because baby's blood sugar is a little bit low. If baby has jaundice, that's another instance where a pediatrician might say to you, listen, baby's looking a little bit yellow. They're a little bit jaundiced. I did a bilirubin level. It's a little bit high. So to avoid the baby having to stay in the hospital for treatment, which is really just special lights that the baby gets put under, baby goes into an isolette that's warm, and there's some special lights that help their liver to mature faster to pass some of that bilirubin. But if a pediatrician says to you, I'd like you to give like just breastfeed first, but just give a little bit of formula, that is actually decent advice, because you have to weigh like what's worse. Is it worse for you to be discharged and not be able to stay in the hospital with your baby because your baby needs treatment for jaundice? Or is it better to give your baby a little bit of supplementation to help the liver to mature a little bit faster so that your baby can go home with you? Keep in mind, once the baby comes out of your body, you are now two separate people. So if you have to go home, which after a vaginal delivery is usually postpartum day 2, but your baby needs to stay for treatment for jaundice, you don't get to stay together. Your insurance won't cover for you to stay in the hospital. So generally, you have to be discharged and the baby stays in the special care nursery. So in that instance, right, if a pediatrician says to you, hey, just want to have you top the baby off with a little bit of formula, even though you don't want to, right, that might be great advice so that there's a higher likelihood that your baby will be discharged to go home with you. So just keep those little, keep those little thoughts in mind if it comes down to that. Okay, so the first option is always express breast milk. That's EBM. Express breast milk is always the best option. I think the initial option, but when it's unavailable, if you're not producing enough right away, then formula is a perfectly viable, acceptable option. There's lots of different brands of formula, and hospitals usually rotate through 2 or 3 different brands. The hospital that I deliver at has Similac, Enfamil, Carnation Good Starts. So, for 4 months out of the year, Similac is what's given. For 4 months out of the year, then Enfamil, and then the last 4 months of the year, it's Carnation Good Starts. Is one better than the other? No, they're all essentially the same. So it's really more like what fits into your budget. What did the baby start on? If the baby started on any formula, and is the baby tolerating what you're giving? So if that needs to happen, those are all viable options for you. So expressing breast milk can happen in a couple different ways. On our resource page, we're going to show you like how to hand express milk from the breast, which is really just a very easy sort of rhythmic type of a massage to express milk out of the breast. Sometimes the easiest way is to just put a pump on the breast. Now, pumps are free for every pregnant woman. All you have to do is get a prescription from your healthcare provider in the 3rd trimester and send the prescription to your insurance company. And your insurance company will then give you options for breast pumps that you can choose from. And then they will mail you a breast pump. It's completely free. So why not take advantage of that? So when we talk about storing breast milk, there is a protocol of what's considered safe in terms of days, weeks, months for breast milk that is just coming out of the breast, and breast milk that's been refrigerated, and breast milk that has been frozen. So for storage of breast milk, we usually refer to our Kelly Mom website on our resource page, and it'll talk about how long you can keep breast milk out in the open, in the refrigerator, and in the freezer. Okay, when we're talking about formula, so let's touch on this just a bit. Breastfeeding takes a little bit longer. Talk about formula. Have you read the instructions, right? Formula comes in different ways. It comes in very simple, ready to feed. It's already done for you. All you do is take a nipple and screw it on top of the bottle. It goes right to the baby after we just heat it up mildly. When we're heating up formula, you do not want to put it in the microwave. That is never a way to heat up formula. You just take a little a bowl of warm water, and you take your formula and you just put it in the warm water, and you want to test that formula right on the inside part of your arm to make sure that it doesn't feel hot. If it feels hot here, it is going to burn the inside of your baby's mouth. So you just want it to feel comfortable, right? Not cold, not hot, just comfortable, almost like you don't notice a temperature change when you put it on the inside part of your arm. That would be an appropriate temperature for your formula for your baby. If you're doing something like powdered formula and you're mixing it with water, you want to read the instructions for the amount of water to the amount of formula, like what's your ratio, how many scoops of formula, how many ounces of water. You can oftentimes make that right in the bottle itself. You can shake it up, right? And then heat it up at that point. Always remember when you're making formula, just to have really good hand washing technique, wash your hands. And then making a bottle is, again, knowing what your ratio to powder to water and what it is, make sure that it's mixed really well, and then make sure that it's heated. People oftentimes say to me, can I put my bottle like on the stove and have heated water? And I'm like, no, not necessary. You're not putting a bottle in boiling water. We don't need it to be that hot. So just warm water from your kitchen sink, bathroom sink, whatever, in a bowl, and then put the bottle in there, let it heat up for a few minutes before you're going to feed your baby. So when we talk about feeding, I want to just kind of talk about paste bottle feeding, because this question comes up quite frequently. So paste bottle feeding is sort of simulates breastfeeding in terms of how we do it. Usually the way it's done, and I'm going to use this as my bottle. It's not a bottle, but you sit your baby up a little bit upright, not laying down. We guide the nipple into their mouth, and then with sort of an upward motion, it's a very rhythmic kind of upward motion, nipple towards the top of the mouth, right? We want to make them work a little bit for that formula, because formula very easily comes out of the nipple, and it can really quickly get into the baby's tummy and cause some stomach upset, not just with too much formula too quickly, but also air. So what we want to do is actually just a little bit of a motion when we feed them in an upright position. So we're minimizing the amount of air that actually goes into their belly. And you may only want to get 5, 10, 15 cc's initially. And then, some bottles are, in the way of ounces, but I think 30 cc's is 1 ounce. But you'll see it marked ounces on one side and cc's on the other. So we do like maybe a half an ounce, and then we let the baby take a break, and then we go ahead and we burp baby, right? And then we go ahead and we feed again. Now, remember, the size of their belly in the beginning is so tiny. So baby may only take a quarter to a half an ounce in the very beginning, but as their stomach starts to stretch, they're able to take more formula. Really, by the end of the first week of life, they may be easily taking 1 ounce to 1.5 ounces of formula, sometimes even a little bit more, depending on the size of the baby. So your pediatrician and your nurses postpartum are going to make recommendations of how much formula you're going to use for your baby in the beginning. So you want to make sure that you have your questions for your pediatrician if you're choosing to formula feed. Do you have a preference for what formula I should use? Do you prefer that I use ready to feed, or does it matter if I use powdered formula? Is it okay if I switch breastfeeding and formula? Can I interchange those things? Those are questions you want to ask of your pediatrician. So, what if you have a baby that has colic? What if you have a baby that has reflux, which is starting to vomit a lot? Your pediatrician is going to have a much greater role in your feeding process, right? They're going to be much more involved. And they may make suggestions to switch formula, to, try breast milk, use express breast milk. They're going to be talking to you about all of that. Okay, let's talk about burping your baby. So when we're talking about burping baby just simply comes up. We talked about that, right? Nice patting on the back, then maybe a little rub. You're listening to see if baby is going to burp. And if not, then we go back to our feeding. We can also sit baby upright, do that same little patting on the baby's back, right? Listening for a burp. You may not get a burp with every single feeding. So know that, completely normal. All right, vitamin D supplementation. People ask this question all the time. Does a baby need vitamin D? Babies don't make vitamin D on their own, right? And they can't go out into sunlight. So for the first 6 months, we don't really have them exposed to direct sunlight. So oftentimes we supplement with vitamin D, a little dropper full of vitamin D. Your pediatrician is going to talk to you about that, adding vitamin D, especially if you're breastfeeding. Okay, sterilizing. What do we need to sterilize? This is actually a sterilizer that can go in the microwave. So if you're using bottles, nipples, they need to be washed really well with each use after you use them. So a microwave sterilizer is pretty easy, right? Pretty easy to do. You just load everything up with a little bit of water inside the sterilizer. You pop it in the microwave for a very short period of time. Everything comes out clean and ready to use next time. Can you boil everything? Yes, you can boil everything. You don't have to buy a sterilizer for the microwave. You can put everything in boiling water and sterilize bottles and nipples that way as well. Okay, before you go home from the hospital, what happens? You and your baby are both going to be checked postpartum. Baby's going to have their weight checked as well. Your OBGYN or your midwife is going to come in and give you instructions for what happens when you go home from the hospital. And they're going to talk to you about how to take care of your incision if you have a C-section. So you're definitely going to see your provider in the hospital each day that you deliver. If you're delivering in a birth center, your midwife or OBGYN is going to talk to you about your danger signs, your warning signs, because you're going to go home a little bit sooner. So you're going to know exactly what your instructions are. They're all going to be given to you. There's no need to be anxious about any of that. You will be given a prescription for pain relief if it's necessary. Many women who have C-sections actually go home on nothing but Tylenol. But if you need some narcotic pain relief, your doctor will give you narcotics to help relieve the pain. I usually recommend that women wean off narcotics as quickly as possible, especially if you're breastfeeding. We talked about that earlier. And then they're going to talk to you about your plan for follow-up care. When are you coming back? As a general rule, if you have a C-section, you're seen usually 2 weeks after your surgery for an incision check. That's just to take a look at the incision and make sure it's healing well. If you have any blood pressure issues, you're usually brought back usually within a week of delivery to check your blood pressure. For a vaginal delivery, uncomplicated, no issues, it's usually you're not seen again until 6 weeks after you deliver, unless something comes up in the meantime, any postpartum depression or any issues. So your doctor and midwife is going to tell you exactly what you need to do, right? What you need to know, what appointments you'll need. So before you go home, as far as your baby, what happens? Your baby is going to have a really thorough pediatric exam in the hospital. They're going to have their hearing checked. They're going to check their hips because sometimes babies are in positions in utero that can damage their hips a little bit. So their pediatrician is going to monitor how the baby's legs open and close, listening for little clicks in the hips that might indicate like an orthopedic issue. So that gets checked. And then your baby's going to have something called a newborn screen, which is a blood test that looks for inborn errors of metabolism. It's done in all 50 states. And the results of that test will be sent to your pediatrician. So we'll talk a little bit, I think, more about newborn screen as we go on. Okay, so leaving the hospital, what are you wearing? You're not going to fit into your non-pregnant clothes coming home from the hospital. It's usually best to wear almost like yoga pants, something that's flexible and gives you room to breathe. Maternity clothes are a great option. Stuff that you wore like when you were in the very early parts of your third trimester. With baby, you want to dress your baby in one more layer than what you're wearing. Obviously, it depends on what the climate is where you live, right? If you're on the West Coast and it's 75, 80, 85 degrees, you're not going to dress your baby in the same as it would be if you're in the East Coast today with like snow squalls and snow falling from the sky. Right? So you want to dress your baby It's a good rule of thumb. One more layer than what you would wear, and you put your baby in a hat to go home, and then just a layer or two of breathable blankets to bring them home in. Your car seat will usually be required for you to go home from the hospital. If you don't have a car seat, you need to call your postpartum unit and say, is that a requirement for me to bring the baby home? Do I have to have a car seat? Most hospitals will say yes, but you want to try a few little trial runs, locking your car seat into the car to make sure that you got it right before you go home, so that you feel confident on the day that you're going to leave and go home. The other thing that you might want to consider, and most people don't know, is that if you have a police station or a fire station close to you, oftentimes there's someone on staff that will fit your car seat base in your car, and they will help you. So if you just call your local police station and say, hey, do you do car seat fittings? And a lot of times it's a service that's just open to the public. Not every police station does it, but most people don't even know that it's available. I didn't know that it was available when I had my kids, and somebody had told me, you can just go down to the police station and they'll fit your car seat base right in the car, so it's safe. And I thought, wow, I wish I had known. But yeah, so just make the phone call. It's worth it. What's the worst that can happen? They say no, and you have to follow the instructions for installing your car seat. If you want to go to the NHTSA website, it's a really good resource for helping you choose the best car seats for the age of your baby and how to use it. And we're going to send you that in our resource page, so you don't need to write that down. What happens after you have your baby? When are you able to get pregnant again, right? So I'm pretty sure that most people don't realize that you can ovulate as soon as 2 weeks after having your baby. There's a very common misnomer out there that says while you're breastfeeding, you can't get pregnant. I am here to tell you I got pregnant twice while I was breastfeeding. I have 4 children. So breastfeeding is a really bad form of birth control. So just know that you can ovulate really easily after you have a baby. So when you deliver vaginally for the first 4 to 6 weeks, we tell you nothing in the vagina. And then we talk to patients about birth control at their 6-week visit. That's your choice, whether you want to be prescribed something for birth control or whether you plan to use condoms or, the cross your fingers method of birth control, the pull and pray. That is certainly up to you. So how soon can you resume sexual intercourse? Most people will tell you, most healthcare providers will tell you 6 weeks. If you have a C-section, you actually may get your libido back and feel pretty good, and you might want to have sex a little bit sooner, maybe 4 weeks after having a baby. I wouldn't recommend it any sooner than that. You still need a little bit of time to heal, especially that incision. So just know that you are fertile myrtle after giving birth. That's what I tell everybody. You are fertile myrtle after having a baby. So if you don't want to get pregnant right away, you may want to take some precautions so that does not happen. How soon can you have another baby? So it does depend on whether you delivered your baby vaginally or whether you delivered your baby by C-section. As a general rule, if you've delivered by C-section, most people will say that in order to have a vaginal delivery after cesarean section, there should be at least 18 months to 2 years, depends on your doctor, so ask, from the time the first baby is born till the time your second baby is born. Okay, 18 months to 2 years. Talk to your care provider and see what their rule is, right? Because it does vary a little bit. That's if you want to have a vaginal birth after cesarean. If you don't care about that and you want to just, continue to have C-sections, then the interval kind of, is a little bit smaller. I tell my patients with a C-section, you want to give that uterus time to heal. So bare minimum, I tell my patients 15 months from the birth of one to the birth of another, but that's going to be a C-section. I actually prefer closer to 18 months, even if somebody says I want to repeat C-section. With a vaginal delivery, it's really not an issue. You can get pregnant right away, but there is a slight increased risk of preterm delivery if you have a very short pregnancy interval from baby number 1 to baby number 2. So when I had my first was 3 months old. I got pregnant with number two. I did have some preterm contractions, thankfully not a preterm labor, but I can speak to you do contract a little bit more frequently if you have a short pregnancy interval. So that's a question to ask your provider. How soon can I have another baby? Those are things that you want to ask. So think about sutures, right? If you have stitches in the vagina, it is going to take up to 6 weeks for those stitches to get better. So that's why we tell women who deliver vaginally, we don't want you to be putting anything in the vagina, tampons, douching, intercourse until at least 6 weeks, because we want those sutures to heal, and we want to see you before we give you the okay to going back to sexual activity and exercise. So your family practitioner, OBGYN, midwife will discuss contraceptive methods that are part of your postpartum checkup. Some women are very interested in some kind of contraception. Other women are like, no, we'll figure it out. We'll do our own thing. So whatever works. Pap smears. Do we do pap smears? So there's new recommendations with guidelines for pap smears. But we recommend that you discuss when the pap smear is appropriate for you and what your time interval for pap smears are. You want to discuss that with your pediatrician or your OBGYN. It does depend on what your history of pap smears are, if you've had abnormals in the past. But the guidelines now say with a normal patient, no history of abnormal paps, every 5 years. So it was every 3 years, and the most recent guidelines actually say a pap smear every 5 years with no history of abnormal paps is an okay guideline. But again, there are certain circumstances where that would change. So you want to discuss that with your care provider. So if you're due for a pap smear, your OBGYN or your midwife will happily do that for you, usually 3 to 6 months after your baby's born. Let's talk quickly about emotional well-being, right? Life can be very, very, very busy and very emotional with a new baby. There's a lot to get done. We can start to think that self-care isn't important, that it's almost like indulgent, and that is absolutely 100% not the case. Taking care of yourself, not just emotionally, but physically as well, sort of fills you up. It gives you what you need to be able to care for your baby. So you cannot neglect your own self-care. When you're trying to care for a newborn, you got to take care of mom in order to take care of baby, right? So it is as important as taking care of your new baby. And your mental well-being and your happiness can also affect those around you. And it can also affect how your baby responds to you, right? If we're very anxious, we're feeling very depressed, that bonding process can actually be delayed. So we want to make sure that we are taking care of ourselves good, right? And really taking care of ourselves well, I should say. If you are feeling good, the people around you, including your newborn, will feel better as well. So take some time this week and think about important self-care activities that you can do, that you'll make time for yourself. Is that getting your nails done? Is it go getting a massage or a facial? Is it, just taking an hour to like get out and get out to the mall, or whatever it is? What kind of self-care can you do for yourself? Let's talk about baby blues versus postpartum depression. So baby blues is really common in the first 2 weeks. Feel overly emotional. You can cry at the drop of a hat. You kind of don't even know why you're crying, but it just kind of happens. You kind of feel like you're not quite yourself, or I don't really recognize who I'm looking at in the mirror. You can be very impatient. You can be very irritable. Those are all very common signs of postpartum baby blues. Very normal. You can feel restless. All of that is normal, and it will usually go away. I think postpartum anxiety is probably one of the biggest overlooked conditions. People talk about depression all the time, but I find anxiety to be even more prevalent than postpartum depression. What does depression look like? It can happen anywhere from 2 weeks to 1 year after your baby's born. It can mean that you're having difficulty sleeping, that you're not sleeping at all. It can look like maternal exhaustion. I don't want to get out of bed today. You can have really no energy, no zest for life. You can have a very, very low sex drive. Changes in your appetite, just kind of don't want to eat. You may start losing weight even when you're not trying to, or you can start gaining weight when you're not trying to. You can have excessive worry, right? Excessive agitation, excessive weepiness, excessive anxiety. So all of those things, if you're noticing those, right? If you're starting to feel completely inadequate, hopeless, feeling like you want nothing to do with this baby that you wanted so badly, those are things that we're looking for that need treatment, right? So if you're feeling that way, sometimes it's not even you that notices it. Sometimes that is something that your partner notices of you. So partners, if you see that, that's a call to your partner's care provider to say, hey, I'm a little concerned, this is what I'm seeing, what do you think about that? Right? Women after having a baby are definitely irritable, we're tired. So I'm talking about excessive irritability, difficulty concentrating, panic, unrealistic panic, not knowing what to do. And we kind of know whether that's characteristic of our personality or if it's something that just never happens to us. If that's not characteristic of our personality and it's happening, we want to absolutely make a call to a care provider. There's so much support available, but we can't offer support if we don't know about it. So if you're starting to have scary thoughts about the baby, I want to put the baby in the trash. I want to dump this baby off at a police station. I don't want this baby. I want to get rid of it. It needs to get out of my house. Those are things that need treatment. You can go anywhere in any police station, in any firehouse, in any first responders office, anywhere in the United States, and you can drop a baby off with no consequences, right? That is important to know. If in our head we're feeling like we're going to do something to hurt this baby and there's no one around to help us, you will not be asked any questions. You can surrender your baby and you can walk away. Now, I know that many of us here don't ever feel like that could possibly happen, but the hormonal changes that can happen in pregnancy coupled with anxiety and depression can sometimes be the thought process can be so powerful and so irregular from what we normally think that I want to make sure that everybody knows that that is an option, right? Obviously, if you're feeling that way, you need to call someone. But if you have no one to call, just know you can walk into any police station, any firehouse, any first responders, ambulance corps, hospital, whatever, surrender your baby. Doesn't mean that your baby's going to be given away. Not at all. Doesn't mean anybody's going to take that baby, but you can surrender that baby until you're feeling better, right? So know that that is possible. Okay, pregnancy-related mental health concerns, really important stuff. 1 out of every 5 women are going to have some sort of perinatal mental health type of symptoms. If you have previous slide for more than 10 days in a row, it is important to talk to somebody and somebody that you trust about how you're feeling. You want to know that mental health symptoms can be treated in any number of ways, right? That can be breathing techniques, it can be relaxation exercises, yoga, participating in self-care, counseling, medication, all of those. There is no stigma to any of those things. Those are all things that can help us through this very difficult postnatal time. Together with your mental health support person, you're going to decide on what the best option for treatment is. Your midwife, your OBGYN, your GP, your designated healthcare provider are going to have resources to 100% help to be able to support you. So here are some tips, and we're going to get into questions in just a moment, but here's some tips for your transition to parenthood, right? Don't try to be the best at everything. Tackle things one day at a time, right? Don't worry so much about everything that has to get done. My house was a complete mess every time I had a baby, right? And I had to stop caring, right? Because it was more important that I took care of my babies than it was that I vacuumed my floors. And I know some of you people who feel like, oh my God, I have to have a clean house. I get it. I understand. Give up what you can give up. If you can't give up cleaning your floors, give up what you can give up. Give up laundry to somebody else, right? Give up cooking to somebody else. Try to get your recommended hours of sleep every 24 hours, right? Sometimes you have to play catch up on the weekends. Sometimes you just can't get it during the week because you're the only person home with the baby. You want to make sure that you're paying attention to eating good nutrition, making sure drinking enough water, especially if you're breastfeeding. Your milk supply is directly correlated to how hydrated you are. So you want to make sure that you're paying attention to hydration. Move your body, right? Get outside, take a quick walk if you need to after you get the okay from your OB care provider. Gentle exercise just even a 10-minute walk can really clear your head sometimes. And never, never, never be shy about asking for help or support, right? It's really, really important that we're able to ask for support. Make time to socialize, even if it's a virtual group. Right now, during a pandemic, sometimes we can't get out or we're afraid to get out, but make sure that you're able to have some sort of support network around you, and talk your issues out, right? A problem shared is always a problem that is cut in half. Know that every single day is a day to learn something, right? When you're a new parent, right? You're always going to have to be open to learning new ways, new approaches to baby care or feeding that are going to suit you, right? Suit your baby's needs, suit your family's needs. All right. So I know I threw a lot at you, but go ahead. We're going to open up that live chat. I want to take